Hey there! I'm so glad you're joining me for this section on legal and ethical issues for the NNP certification exam. Now, don't let the small percentage fool you. This stuff is important. Professional issues only makes up a small portion of the exam, and legal and ethical content is just a tiny 1% slice of that pie. But the section is usually pretty easy to grasp and boost your total score. We'll focus on high-yield topics and, most importantly, how to apply these concepts to the clinical scenarios you'll face on test day. Alright, if there's one thing you absolutely need to know about this section, it's these 4 ethical principles. They make up nearly a quarter of the legal and ethics questions. These are the bread and butter of healthcare ethics. First up is autonomy. This is all about respecting a person's right to make their own decisions. In neonatal care, this usually means respecting parents' wishes for their infant. Then we have beneficence, taking actions to promote good for the patient. This is what drives us to provide the best possible care. Next is nonmaleficence, the classic first, do no harm principle. We're always trying to avoid causing pain or suffering. And finally, justice, treating all patients fairly regardless of their background, insurance status, or other factors. You know what trips up a lot of test takers? Confusing autonomy and beneficence. Remember, autonomy is about respecting choices. Beneficence is about doing good. They can sometimes conflict, and that's when ethical dilemmas get tricky. Let's make these principles real with some clinical applications. When parents want to make decisions about their baby's care, even if we don't fully agree, that's respecting their autonomy. Beneficence looks like recommending a treatment that might be temporarily uncomfortable, but has long-term benefits for the baby. Like when we need to insert a PICC line. Sure, it's momentarily distressing, but the ongoing nutrition benefits outweigh that. Nonmaleficence is why we're so careful about medication dosing in neonates, or why we try to cluster care to minimize handling of our fragile babies. Justice is making sure every baby gets the same quality of care, regardless of whether their parents are doctors or didn't graduate high school. Here's a test tip. The exam loves to test the conflict between autonomy and beneficence. For example, when parents refuse a treatment that the medical team believes is in the baby's best interest, these questions aren't asking which principle is more important. They're asking you to identify which principles are in conflict. When faced with an ethical dilemma, having a framework helps. The moral decision-making model is particularly useful for NNPs. M stands for massage the dilemma, which just means identifying the issues clearly. What principles are at stake? Who are the stakeholders? O is outline options. Brainstorm all possible approaches, even the less obvious ones. R means resolve the dilemma. Apply ethical principles to each option and make a choice. A is act. Implement your decision. And L reminds us to look back, evaluate how it went and what you learned. This is a major testing point, and you will probably see a question or two on this. Make sure you understand who has the authority to make decisions in different scenarios. The number one thing to remember, parents are the primary decision makers for their infants. Period. As healthcare providers, our role is advisory. We can strongly recommend certain treatments or approaches, but we can't override parental decisions except in true emergencies where delay would cause significant harm or death. Ethics committees also play an important role, but they're consultative, not decision-making bodies. They can help facilitate difficult conversations, but don't have authority to override parents. The exam loves to test this hierarchy. They might present a scenario where the healthcare team disagrees with parents' decisions and ask what should be done. The correct answer usually involves more education, clarification, or consultation, not overriding parental wishes. End-of-life decisions for neonates are some of the most challenging we face as NNPs. These decisions always require parental consent. This is non-negotiable. When parents are facing these heartbreaking choices, palliative care becomes crucial. Our role shifts to ensuring comfort, dignity, and family-centered care. This means managing pain, minimizing invasive interventions, and creating space for families to bond with their baby. Cultural and religious considerations take on special importance here. Different traditions have different approaches to death, grieving, and afterlife beliefs. Showing sensitivity to these differences is part of providing comprehensive care. The exam frequently tests who holds final authority in these situations. Remember, unless there's court intervention due to suspected abuse or neglect, parents make the ultimate decisions about end-of-life care for their infant. Here's another high-priority topic. The standard of care is what a reasonably prudent NNP would do in the same circumstances. It's not what the absolute best NNP would do. It's what a reasonably competent one would do. Malpractice is professional negligence. To prove malpractice, all 4 elements must be present, and this is frequently tested, so memorize these. First, a duty was owed to the patient. As an NNP, you automatically have a duty to patients under your care. Second, that duty was breached. You failed to meet the standard of care. Third, harm or damage occurred to the patient. If no harm happened, there's no malpractice. Fourth, proximal cause. The breach directly caused the harm. This connection must be clear. If any one of these elements is missing, it's not malpractice. The exam loves to present scenarios where one element is missing to see if you can identify it. Let's talk about how to protect yourself from malpractice claims. It's actually pretty straightforward. Stay within your scope of practice. Don't attempt procedures or make decisions you're not trained for. Keep your knowledge and skills current. Continuing education isn't just for certification maintenance. It's protection against liability. Document thoroughly. If it's not documented, it didn't happen, as the saying goes. Communicate effectively with families. Many lawsuits stem from misunderstandings or feeling disrespected. Follow institutional policies and procedures. They exist for a reason, and deviating from them without good cause increases your liability. Know the relevant laws in your state. Nurse practice acts vary, and ignorance isn't a defense. And don't underestimate the importance of comprehensive discharge education. Many malpractice claims relate to inadequate preparation of families for home care. Documentation might seem boring, but it's your legal protection. Your documentation should always be factual, objective, and concise. Never include judgmental language or assumptions. Always sign with your full name and credentials. This establishes your authority and scope of practice. Timeliness matters too. Late entries are acceptable, but must be clearly marked as such according to your institution's policy. Never, ever alter records inappropriately. If you need to make a correction, follow proper procedures. Usually a single line through the error, your initials, and the date. For communication between providers, SBAR is the gold standard. Situation: what's happening right now? Background: what's the context? Assessment: what do you think is going on? Recommendation: what do you suggest should be done? Using this structured approach ensures critical information isn't missed, especially during handoffs. Let's get specific about documentation practices. Do document objectively. Stick to observable facts rather than opinions or judgments. Instead of writing, "Patient was difficult," document the specific behaviors. Patient cried during entire assessment despite comfort measures. Always document refusals of care. This protects both you and the patient. Document all patient education, what was taught, to whom, and their demonstrated understanding. Standardized tools and checklists not only improve care, but provide legal protection by ensuring nothing is missed. On the don't side, avoid inappropriate comments that could be perceived as judgmental, biased, or unprofessional. Never alter records at anyone's request. If you're asked to change documentation inappropriately, report it to your supervisor or compliance officer. And please, don't use abbreviations. They can be misinterpreted and potentially lead to errors. Consent is rooted in the ethical principle of autonomy, respecting a person's right to control what happens to their body. It serves 2 key purposes. First, it prevents battery, which is unauthorized touching. Yes, medical procedures without consent can legally be considered battery. Second, it upholds the patient's right to control what happens to their body. There are different types of consent. Informed consent is when the patient, or parents, understand and agree to treatment after being informed of risks and benefits. Expressed consent is directly stated, either verbally or in writing. Implied consent is assumed by the patient's conduct, like holding out an arm for a blood draw. Emergency consent allows treatment without prior consent when delay would cause serious harm. This can occur when consent is needed for an emergency procedure and the parents cannot be reached. The process of obtaining emergency consent varies somewhat by institution and jurisdiction, but the common approach is have two attending physicians independently evaluate the situation, document that the intervention is necessary and of best intent, and confirm that delaying treatment would cause harm. The exam often tests situations where consent requirements might be modified or waived, so know these exceptions. For informed consent to be valid, several criteria must be met. It must be given by a legal representative, usually the parents for neonates. The person giving consent must fully understand what's being proposed, the procedure itself, who will perform it, the risks, desired outcomes, potential complications, and available alternatives. This means we can't just hand parents a form to sign. There must be a meaningful discussion where questions are answered and understanding is verified. Here's a test tip. The exam often presents scenarios where informed consent might be compromised, like when parents don't speak English well or when they're under extreme stress after delivery. Recognizing these situations and knowing how to address them, like using certified interpreters or ensuring parents have time to process information, is key to answering these questions correctly. Patient safety has evolved from blaming individuals to recognizing system failures. A just culture approach focuses on improving systems rather than punishing individuals, except in cases of reckless behavior. High reliability organizations have 5 key characteristics, those being preoccupation with failure. HROs are constantly vigilant about potential failures, no matter how small. They address any deviations from expected results immediately and thoroughly to prevent them from escalating reluctance to simplify. HROs avoid oversimplifying complex problems. They recognize the intricacies of their operations and seek comprehensive solutions rather than quick fixes. Sensitivity to operations. HROs maintain a keen awareness of their day-to-day operations. They ensure that everyone in the organization is attuned to the frontline activities and potential issues that could arise. Commitment to resilience. HROs are prepared to respond to unexpected events. They develop robust systems and processes that allow them to adapt and recover quickly from disruptions. Deference to expertise. HROs value expertise and encourage decision-making at all levels. They rely on the knowledge and skills of their employees, especially those closest to the problem, to make informed decisions. Team Steps is an evidence-based framework designed to improve communication and teamwork skills, ultimately enhancing patient safety. You should also understand the different types of safety events. Near miss. An error almost happened but was caught in time. Precursor. An error happened but didn't cause harm. Serious safety event. An error occurred that caused significant harm. The exam usually focuses on how to respond to these different events rather than just identifying them. Although this is lower priority, understanding basic legal concepts can help with several questions. Civil proceedings differ from criminal ones in both process and standards of evidence. In civil court, decisions are based on a preponderance of evidence standard, meaning it's more likely than not, greater than 50% probability that the claim is true. This is much lower than the beyond a reasonable doubt standard used in criminal cases. There are different types of damages that might be awarded. General damages compensate for pain and suffering. Special damages cover actual costs, like medical bills. Emotional damages address psychological impact. Punitive damages punish egregious behavior. Remember, neonatal cases often have higher damages because of the potential lifetime care costs and the extended statute of limitations for minors. Professional practice encompasses several important areas. Understanding your scope of practice limitations is crucial. Practicing outside your scope increases liability and can jeopardize your license. Professional boundaries must be maintained. Becoming too personally involved with patients or families can compromise care. HIPAA protects patients' private health information. Violations can result in serious consequences, including termination and fines. Fatigue is a recognized safety risk. Being aware of your own fatigue and having strategies to manage it is part of professional responsibility. And don't forget that professional organizations like NIAN and NIA-NP provide standards and guidelines that can be considered part of the standard of care. Familiarity with their position statements, especially those on ethical issues, can help with exam questions. Unlike some nursing specialties, there are no mandated patient to NNP ratios. Instead, workload should be determined based on multiple factors. Clinical setting matters. Are you in a level 2, 3, or 4 NICU? Patient acuity is crucial. Caring for 3 stable growers is very different from managing 3 critically ill micropreemies. Available resources affect workload capacity. What support staff do you have? Are there residents, fellows, or other providers sharing responsibilities? Census fluctuations require flexibility in scheduling and assignments. And don't forget that competence levels should be considered. New NNPs typically need a more moderate workload as they build expertise. NAN has position statements on NNP workload that recommend considering all these factors rather than setting arbitrary ratios. Let me leave you with some key associations to remember. Parental autonomy, primary decision-making authority. Parents, not healthcare providers, have the final say in most situations. Negligence requires duty, breach, harm, proximal cause. All 4 elements must be present. Standard of care. What a reasonably prudent NNP in the same specialty would do. Not the absolute best practice, but what's reasonably expected. Respondeat superior. Employer liability for employee actions. This legal doctrine makes institutions responsible for employees' negligence while on duty. Civil court. Preponderance of evidence standard. This means more likely than not, or greater than 50% probability. Keep these associations in mind, and you'll be well on your way to acing the legal and ethical questions.
Parents of a 26-week neonate refuse a blood transfusion for their critically anemic infant based on religious beliefs, despite medical recommendation. The ethical principle most directly in conflict with parental autonomy in this scenario is A. Nonmaleficence, B. Beneficence, C. Justice. This question is testing your understanding of conflicting ethical principles. The correct answer is B. Beneficence. In this scenario, 2 ethical principles are in direct conflict. Parental autonomy represents their right to make decisions for their child based on their religious beliefs. Beneficence represents the healthcare team's obligation to act in the best interest of the patient, which in this case would be providing the transfusion to treat critical anemia. Non-maleficence, option A, is about avoiding harm, which is relevant but not the primary principle in conflict with autonomy here. Justice, option C, involves fair distribution of resources and equal treatment, which isn't directly challenged in this scenario. The exam frequently tests these ethical dilemmas where autonomy conflicts with beneficence. Remember, autonomy is about respecting choices. Beneficence is about doing what's best for the patient. Neither principle automatically trumps the other. The question is just asking you to identify the conflict. A neonatal nurse practitioner failed to order a critical medication for a septic infant. The infant recovered fully after another provider noticed and corrected the error. In a subsequent malpractice claim, which element would be missing? A. Duty owed to patient. B. Breach of duty. C. Harm or damage. This question tests your knowledge of the elements required for malpractice. The correct answer is C. Harm or damage. For a malpractice claim to be successful, all 4 elements must be present: duty owed to the patient, breach of that duty, harm, damage, and proximal cause. The breach directly caused the harm. In this scenario, there was clearly a duty owed. The NNP was caring for the patient. There was a breach of duty, failing to order a critical medication. But there was no harm or damage since the patient recovered fully without harm. Proximal cause becomes irrelevant. This type of question appears frequently on the exam. Remember, if any of the four elements is missing, a malpractice claim cannot succeed. The exam often presents scenarios where one element is missing to see if you can identify it. A 24-week preterm infant has suffered a severe hypoxic event, resulting in extensive brain injury. After multiple family meetings discussing poor prognosis, a decision about withdrawal of life support must be made. Who has the legal authority to make this decision? A. The Hospital Ethics Committee. B. The attending neonatologist. C. The infant's parents. This question tests your understanding of decision-making authority. The correct answer is C. The infant's parents. Parents, or legal guardians, are the primary decision-makers for their children. This includes difficult end-of-life decisions. The healthcare team, including the neonatologist, serves in an advisory capacity but does not have the legal authority to make these decisions without parental consent, except in true emergencies where delay would cause immediate harm. The Hospital Ethics Committee, option A, can provide consultation and recommendations but doesn't have decision-making authority. They can help facilitate difficult conversations but cannot override parental wishes. The attending neonatologist, option B, can strongly recommend a course of action but cannot legally make this decision without parental consent. The exam frequently tests this hierarchy of authority. Remember that respecting parental autonomy is a fundamental principle in pediatric ethics. An NNP notices an error in medication documentation from the previous shift. The best course of action is to A. Ask the previous provider to correct their documentation. B. Delete the incorrect entry and replace it with the correct information. C. Make a new entry noting the correction without altering the original entry. This question addresses documentation practices. The correct answer is C. Make a new entry noting the correction without altering the original entry. Proper documentation practices are essential for legal protection. When errors in documentation are discovered, never alter or delete the original entry. Option B is incorrect and potentially illegal. The provider who made the entry should ideally correct it, but if that's not immediately possible, you can document the correction yourself. Option A may not be practical. The correct approach is to make a new entry that clearly indicates what information is being corrected, when and by whom. Documentation serves as a legal record, and improper alteration can suggest attempts to hide information. Always follow your institution's policy for documentation corrections, which typically involves noting the correction as a new entry, while maintaining the integrity of the original documentation. Remember, the exam often tests practical applications of legal principles rather than just theoretical knowledge. For informed consent to be valid prior to a procedure on a neonate, which of the following is required? A. The consent form must be signed by both parents. B. The parents must demonstrate understanding of the risks and benefits. C. A witness from the hospital's legal department must be present. The correct answer is B. The parents must demonstrate understanding of the risks and benefits. Valid informed consent requires that the person giving consent, usually the parents for neonates, truly understands what they're consenting to. This includes understanding the procedure itself and who will perform it, the risks, benefits, and potential complications, alternative options, including doing nothing, expected outcomes. Option A is incorrect because only one parent's signature is typically legally required, though both may sign. Option C is incorrect because while a witness to the signature is often required, this does not need to be someone from the legal department. The key to valid informed consent is the informed part. The parents must genuinely understand what they're agreeing to. Simply obtaining a signature without ensuring understanding doesn't constitute valid informed consent. The exam frequently tests scenarios where informed consent might be compromised, such as language barriers, stress, or time pressure. Always look for the option that emphasizes understanding over mere documentation.